give you the highlights and happenings of the authority and the scheme. My name is Shanice Powell. Now to the headlines. NHI launches reforms to enhance healthcare access and eliminate illegal charges. Capacity building training for NHI monitoring and evaluation officers aims to improve healthcare quality. CPC hosts comprehensive training program for claims processing staff in Kumasi. Let's delve to our first story. The NHI Health Insurance Authority's mission centers on providing quality healthcare and ensuring access for vulnerable groups. Today, we bring you a heartwarming story of support and empathy from the KJB district, where NHI staff went above and beyond to assist a distressed pregnant woman in urgent need.
In rural Ghana, access to healthcare can be a challenge, especially for pregnant women. For one expectant mother in KJB, that challenge became a matter of life and death. Suffering from cellulitis, a painful bacterial skin infection, which made the long journey to the KJB NHI's district office on a motorbike, hoping to register for the free maternal health care program. When she arrived, she was in a worrying state, her leg swollen, her skin red and tender, battling a fever. But the NHI staff acted quickly. They provided her with critical information on maternal health care services, swiftly processed her identification, and issued her a new NHIS card, ensuring she would receive the free health care she desperately needed. The woman was educated on how to renew her NHIS membership and encouraged to register for her Ghana card for data integration. Despite her condition, she left the district office with tears of gratitude. The free maternal care program, which began in 2008, provides pregnant women with free NHIS membership, ensuring access to critical health care. Their newborns also benefit from free health care in the first 3 months of life. This program is part of NHI's ongoing commitment to universal health care coverage, especially for vulnerable groups.
Now to our next story. The Chief Executive of the National Health Insurance Authority, Dr. Da Costa Abuaje, has called on staff serving as wellness ambassadors to maintain the highest ethical standards, particularly in handling sensitive health information. This call was made during a training session for NHI wellness ambassadors in Koforidua in the Eastern region.
At the heart of the NHIA New Wellness Checks program is a commitment to promoting preventive healthcare, but confidentiality remains key to its success. Speaking at the ongoing training for wellness ambassadors in Koforidua, NHIA Chief Executive Dr. Da Costa Abuaje emphasized the importance of privacy in building trust between staff and those using the wellness services. Dr. Abuaje tasked the NHIA regional and district management teams with immediately setting up health and wellness units, including wellness clubs and corners in their offices to make routine health checks accessible.
I think every Friday, all staff are to engage in some physical activities. Now, there is something we call health in all policies. We're looking at a day when the Ministry of Agri will have a program called Planting for Vegetables and Fruits, so that all Ghanaians will have fruits and vegetables available to eat. We're looking at a day when the President of the Republic will announce that this day will be a day of national exercise for the whole country. This all syncs to what we call the One Health approach. So we've started. We've launched the annual health check successfully. Its implementation is ongoing, and all regions are being trained on your wellness package. So take it serious and make sure that you fully participate.
The training, led by wellness experts Madam Augustina Nate, equipped NHIA staff with essential skills for managing common health conditions such as diabetes, high blood pressure, and obesity.
Healthy lifestyle. Constant reminders. You have sat for too long behind your computer. My dear, it's break time, let's go. Somebody must push you. You wake up and get swollen feet because we've been sitting for hours. I have to meet this deadline. but your health is deteriorating.
The trainees also received mental health education from clinical psychologist Dr. Akusia Sewabonsu. They learn about non-communicable diseases from Dr. Erasmus Agongo, President of the Public Health Association of Ghana. Nutritionist Madam Renee Opari Otu provided orientation on body mass index, food planning, and nutrition.
So what is the importance of BMI in terms of wellness? Why are we looking at BMI as a health indicator? First of all, it can be used as an initial assessment of somebody's health. So that's the easiest and the most simple thing you can do with regards to checking somebody's health status. It doesn't require much. All you need is to know the person's height and their weight. And so a lot of health practitioners, people who are into research, tend to rely on BMI a lot because it's very simple and you can do it anywhere. You don't need any sophisticated gadgets or anything like that to do it.
This wellness checks program, initiated by Dr. Da Costa Abuaje, is part of NHIA's broader shift from curative to preventive and promotive healthcare. It aims to encourage healthy lifestyles and reduce the prevalence of non-communicable diseases.
NHIS has announced the disbursement of 402 million Ghana cedis to healthcare providers nationwide. This payment covers vetted claims from June to July 2024 and is part of the NHIS commitment to staying within its 3-month reimbursement period. A reporter has the details.
Healthcare providers across the country have received a significant financial boost as the National Health Insurance Authority disbursed 402 million Ghana cedis to cover claims for June and July 2024. The funds aim to ensure the continued delivery of essential healthcare services under the National Health Insurance Scheme. Public health facilities received 224.5 million Ghana cedis, representing 55.85% of the total amount. Private healthcare providers also received 107 million Ghana cedis, while quasi-public health facilities and mission hospitals also received significant portion. This latest disbursement brings to the total amount released by the National Health Insurance Authority in September 2024 to 800 million Ghana cedis, demonstrating its dedication to timely claims payments and strengthening the healthcare system.
The NHIS is set to implement significant reforms to improve healthcare access and eliminate illegal charges in the system. Chief Executive Dr. Da Costa Abuaje announced this during the 4th annual conference of the Private Health Facility Association of Ghana in Koforidua in the Eastern region.
Addressing a gathering of industry players, policymakers and traditional leaders, Dr. Abuaje outlined key components of the NHIA's ambitious reform agenda. This includes prompt payment of vetted claims, an automatic price adjustment system for pharmaceuticals, and the introduction of an e-pharmacy policy to enhance medication accessibility.
From the National Health Insurance perspective, within the last few months, we have been upgrading. And I'm saying we have been upgrading because you all can attest to the fact that in more recent months, we have paid than any other government in the Fourth Republic. Last 2 weeks, I released a whopping amount of 800 million for facilities, of which 400 million was paid. Today, before I set off, I signed off and paid 402 million. In fact, today we are even begging for claims to pay. I do not have any claims on my desk to pay. I'm begging for claims to pay.
The NHIA also plans to absorb all Social Security and National Insurance Trust SNET contributors into the scheme without additional payments.
If you check carefully, under no circumstances should you be denied access to, patients should be denied access to health care just because they are not able to afford just 8 cedis or something, just a minimal fee. So what we have done is that all SNIT contributors have now been enrolled automatically on the NHIS, because already we have deducted 2.5% from their salary. So why then do you have to let them pay again?
Dr. Abuaje emphasized that the NHIS is working diligently to eradicate co-payment, which he described as a significant threat to the scheme's sustainability. The NHIS ongoing tariff review aims to create an automatic price adjustment mechanism to prevent arbitrary pricing by pharmaceutical companies, ensuring that all citizens can access quality care.
There will be what we call the automatic price adjustment. The automatic price adjustment contains a lot in health economics. What this means is that under no circumstances will pharmaceutical companies be allowed to charge anything that they want. It will be within the regulatory framework of what the independent tariff review comes up. So we are reforming, we are upgrading, and trust me, we are poised to ending co-payments. And we will end co-payment in twofold, through our system and also through the task force regime. Because if we are doing our part in paying, we've given the necessary tariffs, then under no moral right will any facility be allowed to charge.
The e-pharmacy policy, currently piloted, will allow patients to collect medications from local pharmacies or deliver them to their homes.
The e-pharmacy policy is also being piloted, supported by the National Health Insurance Authority. Under this, the medication, obviously when the doctor prescribes for patients will now take to the pharmacy, and when the medications are not there, the pharmacist will be mandated to upload the prescription on the e-pharmacy platform and direct the patient to collect the medication at the various local community in which the patient lives, or even to be delivered to the patient's home.
The National Health Insurance Authority, in collaboration with USAID, has organized capacity building training for monitoring and evaluation M&E staff on post-clinical and compliance audit monitoring in Tamale. The event aims to strengthen the NHIS operational efficiency. Here's more on the story.
The M&E officers from the NHIS Northern, Upper East, Upper West, Savannah and Northeast regions gathered in Tamale for a capacity building training sponsored by USAID. The session focused on enhancing their skills in post-clinical and compliance audit monitoring. The training will empower M&E officers to follow up on clinical audits during routine healthcare facility monitoring activities. While they will not conduct clinical audits, the M&E teams will be equipped to ensure effective compliance and reporting.
The Wild West District Office of the National Health Insurance Authority has held a community Durbar at Oli in the Upper West region. The Durbar forms part of the NHIS efforts to engage local communities on the National Health Insurance Scheme's policies and to increase membership. Here's more on the event.
NHIS Wild West District Office organized a community Durbar in Oli. The event saw a large turnout of residents from neighboring communities, including Sanzi, Kori, and Kankazi. The purpose was to educate attendees on the key NHIS policies and promote access to healthcare through the scheme. In addition to educating the public, the NHIS conducted a membership registration exercise, enrolling residents from remote areas to ensure they could access basic healthcare services under the scheme.
To our next story, the Claims Directorate of the National Health Insurance Authority, NHIS, has successfully concluded a 4-day intensive training for its staff at the Kumasi Claims Processing Center, CPC. This initiative, supported by the World Bank's Program for Results P4R project, aims to improve claims management efficiency across the authority.
Over 100 NHIS staff members attended the training, which took place from September 16th to 19th at the N17 Hotel in Kumasi. Participants were divided into 2 groups for focused learning.
Led by expert facilitators from Accra and Cape Coast CPCs, the aim is to equip claim officers with the skills to streamline claims processing and reduce turnaround times. The training also focused on practical skills, covering topics like NHIS operational guidelines, prescription analysis, and ethical practices. Group work and interactive sessions provided hands-on experience for participants, ensuring they left with practical tools to enhance their day-to-day roles.
Up next is preventive health segment.
Key preventive measures for asthma. Asthma is a chronic respiratory condition characterized by inflamed airwaves, leading to wheezing, chest tightness, and shortness of breath. Although asthma cannot be cured, effective management and preventive strategies can significantly improve quality of life. 1. Identify triggers. Recognize and avoid allergens and irritants like smoke and strong odors that can worsen symptoms. 2. Create an action plan. Work with a healthcare provider to develop a personalized asthma action plan. 3. Adhere to medication. Take prescribed medications consistently, including long-term control inhalers and quick relief inhalers as needed. 4. Maintain good hygiene. Regular hand washing and staying updated on vaccinations can help prevent respiratory infections that may trigger asthmatic attacks. 5. Adopt a healthy lifestyle. Engage in regular exercise. Eat a balanced diet rich in fruits and vegetables, and manage stress through relaxation techniques like meditation and yoga. Lastly, avoid smoking. Stay away from smoking and secondhand smoke, which can irritate the airwaves.
Hey, what's up?
How far with your internship?
To be honest, I'm so nervous about starting this new role on Monday.
Oh, please. I know you'll be great at it. You should be worried about what benefits they have. Example, do they have health insurance?
I doubt they will have that for interns. But no shaking. I have NHIS already.
After you answer a line, ting.
Ina, look at you. What are you going to do in the office when you can just download their app to register for an NHIS membership?
Yes, my people, you heard right. You can now download and register your membership on my NHIS app. No long queues or tedious paperwork. All you need is your Ghana card to register for yourself and for others. Once you register, you get a new digital NHIS card on your phone. My NHIS app gives you access to credentialed health facilities and services across the country. NHIS covers over 95% of disease conditions in Ghana. Access to healthcare just got easier.
Now let me sign up quickly. Miss Steph, I'm starting work next month.
That's all that we have for you for this week's edition of NHIS in a Week. For more news, do log on to our website at www.nhis.gov.gh and do follow our various social media handles displayed on the screen. My name is Shanice Palm. Do have a lovely week.